So what are the different grades of varicocele? So typically we classify the varicoceles on the basis of its grade, which means that when we examine the patient, there are certain findings which we note, and then we divide this varicocele into mainly 3 grades. So grade 1 is when we feel these veins only during straining, which is certainly called a Valsalva maneuver. So typically we ask the patient to block the nose and like this, and when we see that we can feel these veins, then this is called a grade 1 varicocele. Now the other is a grade 2 varicocele, which is easily felt while standing, but it may not be visible. So we don't really need to do here the Valsalva maneuver. We can still feel that there's a bag of worms sort of feeling when we are checking the patient. And then there's a third grade, which is visible through the skin and easily felt. Here we don't need to do anything. We can just see the varicocele there. A lot of veins are there in the upper part of the testis, and typically this is called a grade 3 varicocele. So now what happens is when we grade the varicocele, it helps describe the severity of the problem. It may not always predict symptoms or fertility problems, but when we have grade 1 or grade 2 varicoceles, we can usually arrest this grade with lifestyle changes, certain times some medications. But if this grade increases to grade 3 and it is causing problems, then we have to do the treatment with microsurgery.